Welcome back. Well, if you're one of the many Americans who suffers from chronic pain, then you know the toll it can take. It can lead to depression, anxiety, low energy, abnormal sleep. So today, specific treatments to reduce pain and increase your quality of life.
Sounds good, doesn't it? Dr. Rani Chovatiya specials in diagnosing and treating pain, and she's with Spine Pain Diagnostic Associates. It's got clinics in Glendale and Mequon, and it's going to help people feel a little bit better. Good morning to you.
Good morning. Thanks for having me.
Yeah.
Absolutely.
Good to have you here. What made you decide that you wanted to specialize in interventional pain management?
Well, I was born and raised in the Chicagoland suburbs. I attended med school in Chicago as well, and I did a 4-year anesthesiology residency and a year of pain fellowship at the University of Illinois at Chicago. And I first kind of got interested in the area of pain during med school when I actually did an internship at Abbott Laboratories in their pain department. And I also worked closely with several physicians at the university as well in the area. And that really kind of sparked my interest and really kind of wanted me to know more about the field. And in the process, I learned a lot about the obstacles that we're also facing in the field, and the rising number of people that are suffering from chronic pain. About 100 million Americans every year, actually. And that was something that really I wanted to kind of understand a little bit more and try and help those patients out.
I think it's wonderful because chronic pain can be extremely frustrating for
Absolutely.
people who have it. You work with a group called Spine Pain Diagnostics Associates. What do you think makes them different than other maybe pain management places that people can visit?
Sure. Well, we share the same philosophy when it comes to patient care, and that is that we want to try and realize what the underlying cause of the pain is and provide an effective and early treatment for those patients. And our medical director and CEO, Dr. Vijay Singh, has been a pioneering force in the area of interventional pain for over 20 years. And Spine Pain Diagnostics is an independent clinic that's been around during that time as well. And we're constantly on the forefront of various research and in the world of academics as well. So that was kind of a good fit for me. And we're very much advocates of the patient's health.
When you're talking about types of pain that you guys work with, who specifically are you speaking to? People who are suffering from what?
Well, there are a wide variety of conditions. Pain can be the disease itself, and it can also be a symptom of a disease. So, for example, patients with arthritis and cancer can also be having some type of pain associated with that. But there are some patients out there with things called neuropathic pain and with headaches, and that's the primary illness. And we will deal with all those different pain conditions, and it's just a matter of kind of pinpointing what's the main issue, and we'll try to get to the bottom of it.
So back, neck,
exactly.
Headaches, all those kinds of things that are all technically related within the spine.
Yeah, definitely spine-related pain, but also a variety of other kinds of pain, including chest wall pain or abdominal pain, so really a wide variety. But probably the most common pain that afflicts patients in the U.S. is low back pain and neck pain.
Well, think about how many people have been in a car accident.
Yeah,
absolutely.
Even if it's just a little fender bender, sometimes the neck or the back pain that resides, long after that accident stays with you and can become chronic if not treated. And I would assume that's one thing that you really help people understand is the difference between an acute and a chronic pain. What's the difference between the two?
Yes, absolutely. It's a great question. Well, acute pain is a normal response that's triggered by the nervous system in reaction to an injury. So say you stub your toe or you get a paper cut. And typically in the time that it takes to heal from the injury, that's usually the pain will kind of recede over that time. And in the case of chronic pain, that's usually when the pain lasts an unusually long period of time, and it can last up to weeks, months, and years. And in some cases, there can be a cause of that pain, but in many cases, there isn't really any known injury associated with the pain. And more often, we see chronic pain in elderly patients, but we do see it in a lot of young adults too. And we treat all those patients at our clinic.
A lot of people will wonder, are these treatments that they can consider with you, are they covered by insurance?
No, that's also a good question. And many of the procedures that we do complete at our clinic, they are covered by insurance. But if there is any question in regards to a specific treatment that we do offer, the patient can always call us at our clinic and speak to our staff and our billing department. And we work very closely with the insurance companies too, and granting approval if there is a question of that.
Molly mentioned earlier, a lot of times if pain like this is left untreated, it can lead to other things. I would think that most people who are maybe suffering from depression, poor sleep patterns, anxiety, different things like that, aren't associating it with chronic pain in their back or their neck or their body, but that's really something that can happen if left untreated, right?
Absolutely. There is a strong correlation between untreated pain and having those types of symptoms. Untreated pain is quite capable of altering the brain chemistry and even rewiring the nervous system entirely at a molecular and physiological level, causing those types of problems.
Something's got to give, right?
Exactly.
If you're not treating one thing, something else is going to give.
And that's a sign for a patient or for anyone who's listening right now. If you notice these kinds of symptoms, that you're having difficulty sleeping and that you have this decreased quality of life, then you know that this pain is really kind of interfering way too much in your life, and so that might be a good time for you to kind of reach out and seek a pain specialist. So
yeah, I think so too, and I think it's wonderful that you don't just treat the pain or the symptoms, but you try to understand the root cause of it, because then hopefully long term there's relief.
Exactly. And there's a lot of public and medical misconception when it comes to understanding the nature of the pain, the cause of the pain, and how it affects people. And so there are a lot of practitioners out there just from this misinformation which unnecessarily prescribe medications which only mask the symptoms and don't treat the underlying cause, or some practitioners who perform certain unnecessarily invasive procedures. And so our goal at Spine Pain Diagnostics is to understand the why is the patient having these symptoms, and provide a specific treatment plan for their specific condition.
That's great. I think it's important that people contact you if any of those things resonate. The pain, the depression, the low sleep, the low energy, all those types of things that may be linked to that chronic pain that you're experiencing. You can get a hold of Spine Pain Diagnostic Associates. You're in Mequon on Northport Washington Road. Here's the number to call for an appointment. It's 262-478-0301, or paindiagnostics.net is the website to learn more. Thanks so much for being here, Rani.
Thank you so much for having me.
Great to meet you.
It's a pleasure.